I recall a couple of years ago, the ACP launched a program of professional satisfaction champions, of physicians who were being trained to help other physicians find more meaning in their work and combat burnout that way. Is there anything different that these satisfaction champions are doing now in the time of the pandemic? What are you hearing from them?
In the past, a lot of the work of the champions was at chapter meetings. Chapter meetings obviously aren't happening because of social distancing. So a lot of the educational part of it has changed format. There are webinars that are taking place. The ACP has had a webinar on just really some practical tips and advice for managing COVID-19 in your practice setting and in your hospital setting. There's been one that has focused on utilizing positive psychology as well. So some of the same content, but delivered in a different format. The champions have also been some of the key contributors to that discussion forum that I mentioned. They've been asked to weigh in regularly in response to a lot of the questions that the members are bringing forth. The champions are also being asked to help with advocacy efforts as well. A lot of the advocacy work needs to take place at the local level, and so the champions are deployed through the state chapters, and so very commonly they're being asked to get involved in advocacy efforts as well.
Define what you mean by advocacy, please.
So working with local hospitals and health systems to secure PPE for the healthcare workers, things along those lines. Working with local or state legislatures to put in protections that will hopefully allow practices to, again, make payroll, hopefully keep their doors open long term when the acuity of COVID is past.